preparing to live stream. Go ahead and take it away. I'm going to mute my video.
All righty. Good afternoon, everyone. This is the Board of Health update for September 30th, 2020. Commissioner Pettit is unable to join us today. He's got some other business he's attending to. But with that, Amanda, could you call the roll, please?
Commissioner Richardson?
Here.
Commissioner Thayer?
Here.
Commissioner Pettit?
Alrighty, thanks, Amanda. By my calculation, I think we are 200 days past the first positive case we had in the county for COVID-19. Dwayne, with that, I'll hand it over to you for our updates. Thanks.
Okay, good afternoon, everyone. Welcome. Thank you for joining us. Good afternoon, commissioners and staff. I am pleased to be able to provide an update on our public health department, local public health agency activities to date, and also for a COVID update. Next slide, please, Eileen. I also want to touch on resumption of high school sports and performing arts activities and the maximum number of attendees for outdoor events and for indoor events based on the prevailing status under the Colorado COVID dial. And asked the Board of Health for some local maximums for consideration. And we have a few additional public health updates. Next slide, please. Okay, so our current status of COVID in Elbert County. Unfortunately, I have to report that the number of cases has been steadily increasing over the month of September. And when all of the cases for September are noted and confirmed, we will most likely have had more confirmed cases this month than we have in any other prior month. This data that you see on the slide here was written on Monday. Our current caseload is cases to date since March is 162. We've had a couple more cases since I looked at this data on Monday and created this slide. Our 2-week cumulative incidence rate is now 82.44 cases per 100,000. So it has been hovering around the mid 60s to mid 70s range. And the importance of that is the point of demarcation between safer at home level 1 and safer at home level 2 is 75 cases per 100,000. So as of this morning, we are in safer at home level 2, which is an area of concern. And that has lower maximum attendance allowances for indoor events and for outdoor events. And I'll cover those numbers in a subsequent slide. The average 2-week positivity currently, as of this morning, is 4.99%. So a hair below 5%. Again, 5%, we want that 2-week average positivity below 5%, as that is the threshold for understanding whether the virus is being controlled sufficiently within a community. So we are, again, right at the cusp of breaking over that. As of Monday, in the 159 cases cited, the average age was a little bit over 46 years old, That is down a little bit from my last report. I believe 2 weeks ago, the average age was 47 years and some months. The median age has dropped a year from 50. It is currently 49 years of age, median, meaning that half the confirmed cases are below 49, half the confirmed cases are above 49. Our range has not changed, most likely never will, because we have a 95-year-old in there and a 9-month-old. So those are extreme ends of the age spectrum. As of this morning, 2,247 county residents have been tested to date. I am encouraged by the continuing increase in the number of people that are getting tested and understanding the need to get tested. So that is a positive point of emphasis. We have not had any more fatalities to report. We still are holding at our 3 losses to date, and we are holding at 25 hospitalizations currently. Next slide, please. As of Monday morning, you can see where the 2-week cumulative incidence rate stood on the graph here. As of this morning, you would, if I pulled the graph this morning, you would see another slight uptick in this number. Just for a visual representation of the peaks and valleys. And I'll talk in a subsequent slide about what we expect to see in the months to come with Thanksgiving and Christmas holidays, as well as more activities moving indoors. Next slide, please, Eileen.
Dwayne, if I could,
Question,
just
yes,
on
sir.
the previous slide you had mentioned, I think the hospitalizations, that's a cumulative rate. Don't believe we have anybody hospitalized currently, is that?
We currently
we're
have
aware
no
of?
one hospitalized to the
Okay.
best of our knowledge. Yep, that's
Okay.
accurate. Yep.
Thank you.
The Colorado Dial framework that debuted a couple weeks ago. Today we are in level 2, safer at home, which is an area of concern. When I uploaded this slide on Monday, we were in level 1. Therefore, that's why it represents level 1 in this slide. As a reminder, we will not most likely be venturing in to protect our neighbors, or should never venture into the other extreme, the stay-at-home phase. Generally speaking, level 2 is, while it's an area of concern, it's not something we're pushing the panic button on. If we were to have a steady increase in cases and that level of level 2 area of concern move to, trying to look at the metrics here. I don't recall, but it's a significant, it would take a significantly additional number of cases to push it to the cusp of level 3. So again, we'll fluctuate between level 1 and level 2. Hopefully we'll stay predominantly in level 1. Level 2 area of concern is, you know, we're certainly keeping an eye on it and watching the 2-week trend lines, the average trend lines. So hopefully I'm conveying, probably not very well, conveying that while we are in level 2, it doesn't cause me heartburn yet. Next slide, please, Eileen. Our case rates per 100,000 by county. Last week, or last update 2 weeks ago, you may recall that Elbert County was ranked 41st out of the 64 counties in the state. We have moved up and to rank 27th out of the 64 cases, 64 counties rather, in the state. So that is moving in a negative direction. So that is reflective of our steady number of cases and our increases in September. Next slide, please. Geography of cases in the county really hasn't changed. What you're looking at here is a concentration of cases, a preponderance of cases in the western and northwestern part of the county, with the 80138 zip code being in the upper left portion of this map, and 80107 below that. And you can kind of make out where Kiowa is if you can see Highway 86 there about halfway down in this map. Not a whole lot of change here, and certainly reflective of where the population base is. Next slide, please. Okay, switching gears to curative testing resource. As the large-scale testing facilities at the Pepsi Center and at the Aurora Sports Park and the Water World amusement park in Thornton, Westminster, somewhere up there, and the larger one in El Paso County, as those come to a close, additional options are needed, and certainly for rural and frontier communities. So the state has partnered with an entity to provide and I've actually got, I don't know if y'all can see that. I'll take it out of the bag. We just received on Monday, I believe, these test kits, and these are a self-administered test kit. There is a specimen collection swab, and there is a vial with some reagent in it. In the same fashion that folks would take a DNA sample to send into Ancestry.com or 23andMe or one of those other DNA companies. You would swab the inside of your gums and your cheek and get a sufficient sample. I want to say you have to swab for 20 or 30 seconds, and then put the swab in the test tube with the reagent and flip it back and forth a couple times. And then it'll be mailed off to a lab in California. We have the UPS next day air boxes to provide for that mailing. The state has prepaid everything in this first shipment. So this will provide another option in cases or times when the state lab is backed up or commercial labs are backed up or bottlenecked from trying to process a surge in test specimens. Our intent is to get these out to fire and rescue squads so that their team can be tested when necessary, and also to the school nurses, school nurse contacts at the respective school districts. Elbert County received approximately 1,150 of these test kits. This test is for individuals that are symptomatic. And as I note there, it is painless, it's self-administered, it is not a sample that needs to be inserted deeply into the nasal cavity. Once the test sample arrives at the lab in California, test results per contract are to be provided within 48 hours of their receipt at the lab. So assuming 1 day, 24 hours or so for the test to get next day air via UPS to California and then processed. Hopefully this will eliminate a lot of the delays in testing, test result notification, so that if someone does come back positive, we can start the contact tracing sooner rather than later.
So
Unused tests. Go ahead.
If I could just, so it's self-administered, the results are still reported through to Cedars and to the individual submitting?
Correct. Yep.
Okay.
The unused tests are good for 6 months. Once the test sample is collected, there's a 5-day window of viability that allows for, let's say the sample is collected late afternoon and it doesn't get picked up for the UPS run that day. It has a little bit of a built-in timeline there. Let's see, I'm just looking at my notes. That is, I think, primarily what I wanted to cover for this slide. And again, just another resource for our residents, citizens, frontline workers to get tested and hopefully quicker results from this test.
Yeah.
Next slide, please.
Just on that, since, I mean, we've had about 160, I think you said 162 confirmed cases since we began. I'm assuming some of those were asymptomatic. This is over more than a 6-month period there. Do you see some loosening and using, I mean, if these tests are only good for 6 months and we haven't had, but maybe 15% of 1,100 people test positive so far, do you see these expiring, or can they be used if they're not for asymptomatic use or redistributed elsewhere in the state if needed? Or it just seems, I mean, I'm glad we're getting 1,100, but if they're only for symptomatic folks, if we stay on the same trend, we're not gonna use them within 6 months. I mean, I hope we stay on a trend where we don't use them within 6 months. But
that would be ideal, and we could pass them along to another county that does need them. The 1,150 test kits that we were provided were based on a percentage of our population, and that's how they arrived at that number. My understanding, if someone is asymptomatic, that the test is less sensitive in detecting the virus. So I don't know that it's necessarily prohibited or against testing asymptomatic people, but the validity and reliability of results may be suspect, is my understanding.
Okay. Yeah, I would just ask as time progresses if it looks like we're going to hit an expiration date, or
certainly, yep,
that we find a way to get them to where they may be needed.
Yeah, absolutely. And for anyone listening, certainly we'll connect with Peak Vista to make these available, or any other entities that are interested in getting some of these tests. Please connect with me, and I will be communicating their availability in subsequent situation updates that are sent out. Okay, so transitioning to the resumption of high school sports, and I think this slide will just talk about outdoor activities. With the Safer at Home COVID dial, under the Safer at Home level 1, the cautious zone on the dial, the state allows, CDPHE allows a maximum attendance of 250 people at an outdoor event. While we wish we could allow 250 people, we have dialed that back for Elbert County to 200 attendees, and feel like that'll probably address, give or take 80%, give or take a few percentage or a few events, 80% of the events, whether those are high school football events or other community events, car shows and whatnot. Under level 2, it would be a maximum of 125 attendees at an outdoor event. And level 3, again, if we were to ever get there, that's a significant concern, and we would dial back to 75. The attendance maximums are based on the county's status on the COVID dial 72 hours prior to the scheduled start of an event. So that, let's say if there's a football game on Friday night at 7:30, we would have a deadline of communicating that, what zone we're in, the number of attendees, maximum allowable attendees by 7:30 on Tuesday evening. So in the event that something needed to be dialed back, or if we were in level 2 and went to level 1, it could be increased. The appropriate accommodations and communications could be made by the coordinating entity, whether that's a high school or somebody else. And then next slide, please. We'll go to indoor events. Again, under level 1, the state allows a maximum at indoor events under level 1 of 175 attendees. We are comfortable allowing 125 in Elbert County. In level 2, the state allows at indoor events a maximum of 100 people. We're comfortable at 75. And then level 3, we'd be in a significant area of risk there. The state allows a maximum of 75 attendees. We are comfortable allowing 25 attendees. Again, 72-hour window. So some considerations that go into both these indoor maximums and outdoor maximums. We take each request for an event, whether that's a community event or a high school athletics event, take into consideration the specific variables for each request. Some high school gyms have a lot larger capacity than others. Likewise, some communities are smaller than others, and we typically wouldn't see the same number of attendees at an outdoor high school football game in the Elbert community as we would in Elizabeth. We also look at the prevailing volume of infections in the community, and the physical space and the ability to socially distance, particularly important for indoor events, whether that's a performing arts auditorium or a high school gymnasium. And that's, it's almost like, in some fashion, almost like a tax code and trying to figure out a tax code for the entire population. We're trying to take as much information as we can into consideration and be as flexible as we can. However, in the interest of consistency and clarity, I would like for Elbert County to have or to adopt these maximum number of attendees at both outdoor events and indoor events so that we can communicate that maximum so that people are not looking at the state allowable maximums and making decisions based on that. So I'd like to request of the board for adoption of these maximums for outdoor and indoor events. And before that, I guess I should ask if there's any questions or any
Yeah, I have a
clarifications.
question.
Yes, sir.
Why are you haircutting the state allowables?
So good question. So in reducing the number locally, as opposed to what the state allows, the ability to conduct contact tracing should there be an infection at one of these events, our capacity as a public health department is significantly limited. And really, in fact, looking at the number of allowable attendees at an outdoor event under Safer at Home Level 1 cautious, 200 people, we simply wouldn't be able, we don't have the capacity to contact trace. Really, we would be taxed at more than a couple dozen. So I believe allowing this many people outdoors and indoors, if something were to, if there were an infection at an event, with this number of people, we'd still need to call in help from either CDPHE or perhaps Tri-County Health Department. So with that in mind, understanding that we want as many people to participate in an event as is possible, given the state of prevailing number of infections and positivity rates and things like that. Does that help? In a word, it's a capacity issue.
Yeah, and that's, I was going to say, I think the indoor events doesn't concern me tremendously because we really don't have many venues in the county that can get beyond 125 comfortably. And I'm okay with it. I mean, this is our current capacity. I guess I just ask that we also look at over time, what do we need to get to the adequate capacity? I mean, if it's a surge requirement that we can tap into neighboring counties, that's great. If it's but sounds like there's a steady state increase that we need to look at. And I know, I'm not sure if it's in our slides, but we've got a line potentially on a public health nurse. If there's a point we can revisit as capacity grows, we need to. I mean, unlike the tax code, more is better.
And part of that increase in capacity that would contribute to higher limits would be certainly getting a nurse on board, getting another staff member on board that we have funding for through COVID funding.
Yeah. Okay.
And happy to revisit that at that time once we've got everybody onboarded and ramped up. Any other questions or additional information that I can provide to help you make a decision on this request?
I think we're good. I would like to have Rick involved as well. So maybe it's something we address at next Wednesday's regular board meeting as well. Just
okay, fair enough.
Yeah.
Okay.
Can I just interrupt real quick? I'm sorry, Commissioner. We have our next VOCC meeting is scheduled for October 14th.
Oh, the 14th. Okay. Yeah. Well, that's a little ways out, but still, I'd like to get Rick involved. Maybe we just, we'll figure out how to address it properly. But whether it's just a quick special meeting or just a advisory from all three of us, but thank you for that, Eileen. I lost track that we had kind of an extended period between meetings.
Let's go to, so additional public health updates. So last week I connected with CDPHE's Office of Suicide Prevention, spoke with their director and also their coordinator for youth suicide, and talked about a number of potential options for messaging destigmatization of behavioral health, mental health issues that contribute and may lead ultimately to someone dying by suicide. I have been in touch with Centennial Mental Health to begin a conversation on how we can potentially partner on future efforts. September is, I believe, National Suicide Prevention Awareness Month. I may not have that designation, that observation exactly correct. One thing I don't think I put on this slide was a resource called mantherapy.org. It is an online, it's a website with online resources, mantherapy.org. And it takes kind of a lighthearted look at some of the barriers that particularly men face when it comes to requesting help or talking about mental health issues. We certainly want to work with schools and see if they, or what their postvention plans look like, if they have someone, a student with either suicidal ideation or a student that has made an attempt at self-harm, and how their response looks, and support schools in any fashion that we can. I anticipate that as time goes by, well, we'll start with making training and supports available to local folks if they're not already aware of them, local organizations, supports that are available from CDPHE's Office of Suicide Prevention. And I certainly want to highlight, and this is something we can do, make an ongoing message in our various communication forms on the National Suicide Prevention Lifeline. I encourage everyone to put that phone number in their contact list in their mobile phone. And also know that the crisis text line resources are available by texting TALK to 741-741. I also want to promote everyone getting a flu shot as soon as possible. Again, flu season will be starting soon. It'll peak in a couple months. The shot does take a couple weeks to become effective. So the sooner you can get that, the better. We have had initial conversations with Peak Vista Community Health Center on how we can potentially support them. I do anticipate once we get a public health nurse on board that will be certainly part of that person's role, either in a support capacity to other organizations or in a lead capacity through the health department. I do also want to backtrack a little bit, and I apologize for not dovetailing this with my COVID update, but just this morning, the state epidemiologist gave us an update on some COVID data and projections. Social distancing is down in the statewide measures. It's down to 65%. Ideally, it's at, I may have said that wrong. It's down to 62%. Ideally, it is at 65% or higher. There is some preliminary indications that hospitalizations are increasing statewide. The percent positivity of tests is increasing statewide. There has been an increase in the asymptomatic testing that's occurring on college campuses, particularly at the larger state universities, and some, I believe, the University of Denver, in Denver. You may recall that a lot of the uptick in the statewide numbers in weeks past this month were driven by that 18 to 22, 23-year-old population. And I believe at one point, like 40% of the new cases were in that small age group. However, it appears that across all age groups in September, the number of confirmed cases is rising. There was also some discussion on how the holidays may impact COVID-19 in Colorado and why the next couple of months are so important as we get closer to Thanksgiving and Christmas, and that 18 to 23-year-old age group is coming home from high transmission communities, and also older generations of family are congregating in a relative's home. A lot of the scenarios assume, the modeling scenarios assume that social distancing will decrease anywhere between 10% and 20% starting with the Friday before Thanksgiving. And that decrease will last until January of the new year. In reality, we don't know how much the contact rate will change over the winter holidays, but it's certainly an area of emphasis moving forward. The state epidemiologist also shared that the estimated prevalence of infections in Colorado are that approximately 1 in every 990 Coloradans is infectious at this time. That is more, or how, depending on how I frame that, that is more infectious residents than the last report. At last report, it was 1 in every 1,000, might have been somewhere between 1,000 and 1,100, but that number is decreasing, which indicates a rise in the number of people that are infectious. And certainly it's higher than last week. Approximately 302,000 Coloradans, or about 5.2% of the population, has been infected at some point since the inception of this pandemic. Let's see, and I'm just looking at my notes here. There is soon going to be a transition of verbiage, or a change in verbiage from the term social distancing to messaging transmission reduction. And the reason for that is social distancing is one component of transmission reduction, but transmission reduction also incorporates all behavioral and policy changes in response to the pandemic, including mask wearing, physical distancing, improved ventilation, working from home, contact tracing, isolation and quarantine, moving activities outside, and seasonal impacts on transition. And I believe that is it for the updates on COVID. Lastly, I want to share that anyone that is interested in receiving the daily situation updates that are sent out via Constant Contact, please shoot me an email, and just all you have to do is say, I'd like to be added to the situation updates, and I will add you. The more people that have current and accurate information, the better decisions everyone can make. So want to make sure folks are know about that availability of current information. And with that, oh, one last thing. Yesterday, the governor's office debuted some revised school and childcare guidance that will be effective October 5th. Our contact tracer, Catherine Reiber, has already sent that to the school superintendents and the school nurses in each district. And we are advising to go with the protocols in the document today, and not wait until next Monday, October 5th. One of the several significant changes is you may recall a conversation in months past about COVID symptoms where we classified symptoms as being minor symptoms or major symptoms. And obviously, the more major symptoms a person had, the more indicative that was of a COVID infection. There has been an addition to that stratification, and that being critical symptoms. And the first critical symptom is a recent loss of taste or smell. So if someone suspects that they may have a COVID infection, that's one of the first questions anybody's going to ask a provider or the contact tracer is, have you or have your spouse or child had a recent loss of taste or smell? That appears to be, with increasing reliability, a critical symptom indicating a COVID infection. So that is the latest on the symptom updates, and I believe that concludes my update, and I'm happy to take any questions or comments.
Anything from you, Grant? Or
I don't have any comments. Thanks for the presentation.
Thank you.
okay, and Dwayne, I just the one I truly appreciate the thorough update. The one lingering concern I still have, especially since we're relying so heavily on numbers per 100,000, is just continuing to kind of press the state on why they use a lower population number than their I mean, I know it normalizes everything and everybody's being counted a little short in population, but they seem to be about 2 years behind the state demographer in actual numbers. And since these are triggering restrictions on what folks can and can't do, I just appreciate continuing to kind of ask.
Yeah, I do sound
why
that.
are we cutting
I
ourselves
do make that
short?
known to them.
Yeah.
Yep.
Yeah. Okay.
I'll continue to beat that sounding board.
Okay, very much appreciated, and please keep us in the loop on our potential public health nurse. That was good news, and I hope it comes to fruition.
Hopefully by this next update, Board of Health meeting in hopefully 2 weeks, I'll have some positive news. So,
okay.
Yeah.
All righty. Well, thank you very much. If there's nothing else, I'd accept a motion to adjourn.
So moved.
No, second, all in favor? I think I am. I know you are.
Aye.
Aye. Okay, we're adjourned. Thank you very much. Thanks,
Thank you.
everyone.